Hey guys, Dr. Gary here. So as you know, I'm double board certified and do facial plastic surgery and hair restoration. This topic actually comes from some of the comments that you guys have put on my videos, and it's about microneedling and derma rolling for hair restoration. And I want you to stay tuned till the end because I'm gonna actually offer some recommendations for a protocol that you can use for at-home microneedling. In general, I'm not a huge fan of the DIY culture when it comes to doing things, medically related. However, there's actually research studies that are done with microneedling being done at home as part of the study. It's like an accepted type of process as opposed to some of the other stuff that you guys have seen of mine, like the fillers and the Botox that people are doing at home. Much more dangerous. It's much harder to kind of really harm yourself doing some of this at home. So of course, be smart about it. Always consult with the doctor before you get started. But there is sort of some general guidelines I'm going to give you at the end of the video. So let's jump into it. Microneedling. What is it? It's also called percutaneous collagen induction therapy. And it's basically multiple fine needles that are used to create these like micro punctures in the skin. And the therapy is relatively new. It came about in the 1990s, and I think it was 1995 that it was first demonstrated to be effective for scars, for skin laxities, kind of like how it started out. And then these days it's used for many different things, microneedling, such as flap and graft survival when we do reconstructive surgeries, hyperhidrosis, so excess sweating. There's also a movement for basically delivering drug therapy using microneedling, right? Because creating little punctures allows things to enter in, and that's going to become applicable with hair as well. Things like melasma, also of course skin rejuvenation, all of that has been shown to be improved with microneedling. And also for hair, so it's been used for different types of alopecia, either as monotherapy or in combination with other things like minoxidil, with steroids, with vitamins, with PRP. So you can do the microneedling alone, or you can combine it with those other modalities. And all of that has really solid evidence behind it, like randomized clinical control studies to support its use. So what are the mechanisms for hair regrowth? Like, why is the hair growing back? And there's two general concepts here. One is increasing the growth factors in the local vicinity of where you've done the microneedling. And if it's combined with PRP or platelet-rich plasma, then you get the added benefit of the actual platelets that you're putting back to the scalp opening up and spilling their growth factors. So there's that, but then even without PRP, it's been shown that the growth factors in that local area increase with microneedling as the body looks to repair itself. And the other mechanism is activation of stem cells in the hair bulge area. That's where the stem cells live when it comes to the actual follicle of the hair. That has been shown to increase with microneedling. Microneedling has been shown to actually produce new hair follicles in mice. And then in humans, and when we look at like the actual, zoomed in pictures of the hair, overall thickness of the hair tends to increase, and there are fewer miniaturized hairs, or what we call villus hairs, and they become more terminal hairs, or more essentially mature type of hairs with the microneedling. It's not common that you increase the actual density of the hairs. You increase the actual like diameter of the hair shafts, along with of course turning the finer hairs into more mature hairs. So all of that is helpful. And then in terms of indications, like what types of hair loss could you use microneedling for? Androgenic alopecia, which is the big one, that's the male pattern hair loss or female pattern hair loss. So that has been shown to be helped with microneedling. And alopecia areata, which is a condition that I have, though I have a more aggressive form called universalis. But alopecia areata, where you just get like one spot, say on the scalp or on the beard, microneedling has been shown to help with recovery of those bald spots. And also telogen effluvium is another hair condition that can also be helped. So then in terms of the delivery of the microneedling, right, like what is the actual system that's delivering those needles? There are different ways to do it. The crudest way, which is actually what we typically do when we do PRP, is using little tiny needles. Usually we use like 2 30 gauge needles. Once the PRP has been placed into the scalp, you go in with these little tiny needles and you basically go around the scalp manually and do that throughout the scalp. It's not really something that is easy to do at home. It's not really what is used, like say on the face, for example. So the more standard ways of doing it are either with derma rollers. Basically, it's this device that's passed back and forth multiple directions, and it produces these little micro punctures at the skin surface. The problem with the derma roller is that it can actually break the strands of hair. So it can kind of cut the hairs. They'll ultimately grow back, but if you're not looking for a haircut, I mean, it could be a problem, because you're going to thin out your hair. So that's the issue with the derma roller. The alternative is a derma pen, which punches vertically with the needles onto the skin. And so that is the more recommended type of derma rolling or microneedling. The better thing to use is a derma pen if you can, and that is coming in again vertically and creating those stamps, and then basically avoiding the breakage of the hair. That covers the delivery mechanisms. Now, in terms of the depth, right, like how deep, how long should these needles be? There's really no true consensus in the literature on this right now. The studies that have been done on this subject have used lengths of needles from 0.6 millimeters to 2.5 millimeters. That's sort of the wide range. When people are doing this at home, they're usually using under like up to maybe 1 millimeter of depth, because the deeper you go, the more painful the process is. And there has been some data to show that hair growth actually varies based on the size of the needle and the number of times that the skin was rolled over. So usually the longer the needle, the deeper you go, and the more times you roll over, the better the results. That is kind of what the studies have shown. But the problem is, if you go too deep, then you risk getting scarring, scar tissue formation, which can actually then hurt your ability to grow hair. That's where the potential harm comes in when people ask me, oh, can I just microneedle at home, like, you know, every day? That's where you can run into trouble. If you go too deep, and if you're doing this too often, you can run into scarring problems. So again, like any therapy, whether it be like a procedural therapy or drug therapy, there's like a therapeutic window, and you can fall just short of that and not see any benefit, or you can go overboard and actually cause harm. So you got to be careful. The other interesting thing to mention is that in alopecia, specifically androgenic alopecia, as it advances, the scalp generally thins out. And we're going to put a table up here. There's been actual calculations that have been done in normal controls, initial stage of hair loss, and then advanced hair loss. The scalp is getting thinner, so you have to adjust for that if you're doing microneedling. You have to adjust the depth of the needles. So the longer ones, like generally 1 to 1.5 millimeters, can be helpful in the initial stages. As the hair loss progresses, you're going to want to go for shorter needle lengths, like 0.5 to 1 millimeters, for example, just to adjust for that thinning effect that occurs over time. As far as actually applying the microneedling, it can be painful, so there are different ways to kind of numb up the area. At shorter depths, sometimes you don't need any numbing, but it's sometimes nice to use a topical anesthetic, like what I use in the practice sometimes for that would be BLT or betacaine, lidocaine, tetracaine. It's a mix. You need a prescription for that because there's some toxicity risk of using too much of it or leaving it on the scalp for too long, so you have to be careful. There's also injected anesthesia that can be used to numb up an entire area before that type of therapy. And then again, sometimes people don't use any anesthesia for, again, shorter lengths of needles, but for deeper needling, you need some kind of anesthesia. You're going to want to disinfect, or your doctor needs to disinfect the area before you get started, and that could be done with something like a betadine solution, or there are different aseptic sprays out there as well. You have to select the proper depth, and it's also about how many applications. So how many times do you go over the same area? The average out there is usually 3, but again, it's more about looking for the desired endpoint rather than how many times you're rolling over. The desired endpoint is pinpoint bleeding and mild to moderate erythema, which is redness. Once you reach that endpoint, you should stop. You shouldn't just keep going. It's typically safe to wash the hair at least 6 hours after treatment. Some people will just wait until the next day to wash their hair. When it comes to frequency, like how often should you be doing microneedling on the scalp for hair restoration? Well, the data is kind of mixed, right? So some studies recommend weekly treatments and have done weekly treatments and shown improvement. Some studies have gone all the way out to 8 weeks. That's the range that I saw in the literature. 1 week to 8 weeks, that's the frequency that you can microneedle. Again, whether you're going to the doctors or choosing to do some of this at home. And then there are these other combinations, right? Like adding something to just microneedling alone. And that could be minoxidil, which is also called Rogaine. Usually you don't want to do it on the same day. So you don't want to like microneedle and just apply the minoxidil because it can burn because of the alcohol content that exists in minoxidil. And then there have been studies that have shown that there are greater hairs actually produced from microneedling with minoxidil compared to just using minoxidil alone. So there is data to support that combination. And then also PRP, platelet-rich plasma. We talk about it in some other videos, but there was a study from 2019 that actually showed that PRP with microneedling is better in comparison to PRP alone or minoxidil alone with patients with androgenic alopecia. So good data to support the use of PRP with microneedling, because again, what I said earlier, where you get that kind of double impact in terms of additional growth factor release, because you get the release from just microneedling, and then you get the release because of the platelets that you're introducing, so that's helpful. And then also steroids can be combined with microneedling, and that's used for conditions like alopecia areata that's more confined to a specific site. In terms of side effects, you can expect some itching. Sometimes the redness, the erythema can last for a long period of time. Hair shedding is possible, especially in the early kind of period when you first start this for a few months. Infection is always a risk because, you know, you're making all these little tiny pokes in the scalp. Some people can have a reaction to the local anesthesia that's being used. So again, that's not something you would be doing at home. That's obviously under proper medical guidance, but even then, there are different potential toxicities of anesthetics, so that has to be done carefully. And then there's a risk of scarring that we already discussed. So we still need, as a community, in terms of our literature, to determine the ideal needle length, the best frequency of treatment, and the best combinations and how to best administer them. And then as far as at-home regimens, and again, there have been research studies that have been designed in this way, and that's why I feel comfortable bringing some of this up with you guys. One way to optimize the application, as we talked about previously, is with the Derma pen. So that's that stamping, the vertical stamping. So that would be a better thing to use than just rolling it. You have to make sure you clean the scalp well, and we talked about ways of doing that. In terms of depth selection, I would start with the lowest depth, the most shallow depth, and that typically is like 0.5 millimeters. You want to be effective in your delivery, else what's the point of doing it? But you don't want it to be harmful and potentially cause unnecessary pain and potential for scarring. So I would start with a 0.5 millimeter depth. That's a tolerable type of depth for most people, and it can still yield results. I would start with one application just to begin, till you're more comfortable and can move on to something closer to 2 or 3 applications. And that's again how many times you're going over the same general area. And I would start with monthly application as opposed to doing it. Definitely don't do it every day. And then from a monthly application, you can slowly increase it to maybe every 3 weeks, then every 2 weeks, and maybe doing it weekly if again you can tolerate it. And I would definitely be kind of checking in with your doctor, making sure you're not developing any signs of scarring and that you're continuing to have good results, right? Or else don't do it if you're not seeing any results. But with most types of hair treatments, I advise that people give it about 6 months before giving up on the treatment, unless of course there are complications or reasons you should stop. And again, in general, best to talk to a hair doctor about these regimens before you get going on it. That's pretty much my spiel to you guys on microneedling and derma rolling for hair restoration. I think that it's a very viable medical therapy. It has good data to support it. It's very much in line with data that exists on PRP therapy and on low-level laser light therapy. So they're kind of comparable. It's definitely a good solution, and even more powerful with those kind of combinations that we discussed. So hopefully you guys found that useful. I'm still working on my video on medical therapies for men and women, mainly for androgenic alopecia. Just trying to be very comprehensive about it. Stay tuned for that. I know you guys have been asking me for that video, and it's coming. Hopefully this was helpful. Check out all my other videos on hair restoration, hair transplant surgery. Drop me a comment, tell me what you think. Was this is helpful. I know a few of you had asked me to make this video, so I hope it's helpful. I really want to make sure that these videos are rooted in science and are not just like, you know, just my opinion, and most of my channel is that. I try to kind of reduce it down to the essentials and try to eliminate a lot of the technical terminology, but you guys are smart and able to figure all this stuff out. So hopefully this is helpful. Please like the video and subscribe to the channel so you can you know, be updated anytime we post something new. Take care, guys. See ya.